So for part 2, for relationships and love, my name is Richard Clark, and I'm a hypnotherapist for the last 9 years and a holistic therapist for the last 14, 15 years. I'm going to carry on this part 2 about relationships, love before and dating before engagement. So I'm just going to carry on part 2 and you'll follow on. Please watch part 1 to understand where I'm coming from. So anyway, recent research findings within relationships or studies. If there was a 2023 study in the Journal of Consulting and Clinical Psychology found that couples who received integrated attachment-based therapy showed significant improvements in the following. Relationship satisfaction was a 67% improvement. Communication patterns was a 58% improvement. And conflict resolutions was 45% improvement. I think that's quite crap, to be honest. I think you want conflict resolution should be a lot higher than that. But again, that's probably because a lot of practitioners don't. There's a lot more deeper things with that. And emotional intimacy was up by 52% improvement. So when we're talking about this, we talked about, as I'm a hypnotherapist, so forth, I'm going to talk about some therapeutic tools and methods we've used. So assessment tools is relationship belief inventory. So what is the relationship, the benefit of that relationship and that belief within that? What's the beliefs of them individuals and with as a couple together? What's their shared values? What do they align with? Number 2 is their experiences in close relationships scale, which is they call it is an ECR. The experience in close relationships is what their relationships are like, not only with their spouse, it's what their relationships are like with their family, with their mother, their father, their cousins, and so forth. Also previous relationships in their boss, their workplaces, school, and so forth. There's a lot of these issues do come up a lot up in relationships. Number 3 is communication patterns questionnaire. It's like, how do they get a situation and how do they communicate to get around it? And how do they communicate an issue? So if someone doesn't like they've got a form of OCD or very form of it, and then the other partner is messy and keeps leaving all the food and washing up, that will annoy someone. And that could be something which is a personal gripe, but not actually a relationship issue. So it's about getting it right. Next thing is the intervention technique. So when we're intervention, how do we go in with that to help it? So Hypnotherapy Protocols, this is the first load, is regression for relationship pattern identification, right? Within that is how do we look at the relationship patterns and identify where these issues are in the past and how they're affecting the present. The inner child work for attachment healing. So inner child work, how do we feel as a child? See, if we've grown up as a child and we've seen our relationships of our parents or the relationship of our parents to ourselves is not very strong, then there can be a lot of neglect, there can be a lot of rejection, all these things come into present relationships. So we have to work with them. Future progression visualization. I'm a future life progression therapist, which means I actually help people see their future 1 year, 2 years ahead. Very useful for people in relationships, especially if they want to have a house together, children together, whatever that is. The visualization is to see, once they've got rid of these issues in therapy, is where their relationship will be. And for some relationships and some clients, they don't see the relationship they think they're in. And that can be very upsetting for some people. But then it also can sometimes mean is also working out where they are. And that's very hard because most people want to work at things, especially in relationships or marriages. But that's not always what the case is. Again, you've got to do what's right for the client. And resource state building. So how do we get resources? How do we build up them resources so we have different ways of doing things? So if someone's got a temper problem, how do we teach them to keep calm? Or we teach them breath work, pranayama work, or we teach them mindfulness. All these different things you can do about how people, and then change their triggers. Maybe that one don't like someone smoking. So how do we stop the smoking to stop the other partner being angry about it? Okay. So CBT tools, cognitive behavior therapies, relationship beliefs worksheet. Again, the beliefs are about your cognitive issues and your conditioning of what your beliefs should be in a relationship. Okay. Communication tracking logs. So looking at the tracking logs of how the communication is. So if one person's over communicating and the other isn't, then it might mean that they actually don't want to do that. They need to kind of balance it out. And from personal experience, I've been with people who communicate too much. Not good. It can end up being a bit, actually, it's like a bit overbearing. And I think people need to understand the differences. What they have to do is separate the time. So when you're at work, you're at work. When you're at home in your private life, you're at your private life. When you're with friends, you're with friends. There has to be that individuality of freedom and not to feel judged. I think that's very important for people to understand. Emotional awareness journal. So people, but women more do this more than men. Men do not write diaries generally, but journaling about how they feel when a situation comes up, how they feel, how they've responded, how they feel bad if they've responded in a bad way. This is very important because it also, if they give these to therapists, we can then help working that. Because a lot of people don't always understand where they go wrong. They just don't. And so that's why some people end up in therapy for many, 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 many weeks, many sessions. Whereas actually, if you've got the person who's done the pre-work after a consultation, and then they say, right, go away, write down all the things what have upset you in the next few weeks, and then they send the journals or send things what they've dealt with, that also helps because it means that you can shape the session and to get more, in as I say a 3-part session, so 3 2-hour sessions, you can get more impact in the work and get to the crux of the issue. Very important. And I think it also makes our time better. Otherwise we could be running all over the place for every little argument. It would just take too long. Integrative methods. So mindfulness exercises for couples. So again, like I said about mindfulness, about how we do that, how they work out conflict resolution. Yeah. Attachment-based exercises. Again, same thing. Where's the attachment here? Emotional regulation techniques. We talk about how to control how we react to things, and trust-building activities. So with all this, the treatment outcomes and progressive markers. So the short-term goals of all of this is to improve your communication patterns. This is why actually with most people, even when I was a holistic therapist, when I was doing chakral healing work, most people's underactive issues were the throat was underactive. They couldn't communicate things, but their heart was overactive. And I get used to thinking, why was that the case? And it's because they're so over-emotional, but they don't explain where their issues are. And then what they would also do is they find out their third eye, which is about their intuition, is it's overworking because they're always overthinking. Oh, what if I said this? If I said this wrong, what would it happen? And if I think this or act like this. So it's very important to get them all balanced. And communication to me is a key. I think if you do not communicate in relationships, you are in some respect doomed to fail if you don't better that issue. I think it's very important. And going into that is the reduced conflict frequency. Reduce the amount of conflicts you have. Don't just try and pick on things all the time. Try and find a balance. Yeah. And you do have to compensate sometimes. There's some things which you know you should go angry about, but actually, are they that important? Like to me, if you haven't paid like an electric bill, is that something to get angry about compared to someone who's like just hasn't put the bin outside? See what I mean? It's like you've got to see levels of where you use your conflict. Yeah. I know this is a bit of a silly example, but you get the idea. Enhance emotional awareness, being aware of your partner, being emotional, and also because what partners do as well, especially when they're in dating, they try and trigger each other. So they know where their weaknesses are. And sometimes that's very much a form of coercion. It's also a form of like controlling behavior. It's very worrying when people do that. So they try and find their weakness and then they'll pick on it. And that's when sometimes you brew anger with someone. When someone's ready to snap, they're keeping calm. And then when they do snap, they go, oh, this person snapped at me. They've done this. They've done that. But what they don't explain and don't tell you is they've been winding this person up over so many weeks or months and can be even years. So again, people need to be aware of their behavior. Better stress management in relationship. Stress management. Again, stress management, you can always calm down. You learn how to calm, you learn all these things. But however, if you don't communicate, these will always be affected. Now, your long-term goals, these are probably the most important if you want to go into marriage, after engagement, pre-engagement, and marriage, then children and joining of two families together, is the secure attachment development. How that when you attach and how it works, that you feel secure in that situation. You feel that you are not worried. You're not worried of cheating. You're not worried of infidelity. You're not worrying of people being addicted to porn, all these different things. You're not worrying about commitment issues. You're not worrying about abandonment issues. These are very important issues. And again, I feel, like I said, again, I'll keep reiterating it. Communication is always important within this. Healthy relationship patterns. What is healthy relationship patterns? Well, these are things where you feel that every person has their own space as individuals, but when you're together as a unit, it is stronger. And that is a healthy relationship pattern, where if you have an issue, you can communicate it without the other person going half cock at it. Yeah. Sorry for using that sort of language, but it's true. People do have a very much they go from some people go from 0 to 10 very quickly, where it's about keeping calm, keeping level-headed, and knowing that if you want this to work, then you want the best for that relationship. And that is being level-headed. It's always got to be how it works. And then when we're looking at it, is stable commitment levels. Are you committed to this relationship? And if you don't think you are committed, be honest and say, this is just not for me. This is not working. And sometimes you can go through therapy and find out it just isn't going to work. No matter how much therapy you can have, you just find that actually it's not going to work. And that's about honesty. And again, that's why I think communication is so lacking in so many areas, because people aren't honest. They've created lies. They've created a facade of who they are. And it doesn't work out because the cracks start showing. Sustainable intimacy. So this is the issue with a lot of people in dating. When they're very much invested in dating, they're overly intimate. And then when they get engaged in marriage, it becomes lazy and lazy. Sometimes also with women, when they've had a child, they don't feel so much intimate. They feel fragile. And then men don't know how to, and then some men feel that they need to have certain needs, their needs fulfilled. It's very important things. And I think it's, again, having that communication. And I mean, for a lot of men, and I won't go into this too graphically, but for some men, once they've seen the child being born, that's why for so many years, they used to say that men couldn't see women giving birth, because they did claim for many years in a lot of studies, a lot of men, once they saw a child being born out of a woman, it frightened them. It frightened them for everything about sex. It frightened them about intimacy. They also were in awe of it, because it's such a thing, which is such a natural thing, but it's also so empowering. It's also for a woman, but it's also so shocking for a man to see them go through that pain. That's why they've done the experiments where they use men with shock treatment on when they see what it's like being pregnant. And most men can't handle the pain. So imagine what a woman deals with for 9 months carrying a child and all them issues they have to deal with. It does give people more perspective and gratitude of what they go through, which is why we should be wary of our sexist language of misogyny and misandry as well, you see. So a recommendation for practitioners, which is always good for anybody, including myself, to always remind myself, is assessment guidelines. Is always conduct through attachment history throughout it. Always look at the attachment history of anybody you're working with. Evaluate their relationship patterns. Always look for their patterns. Where's their issues? And most people's patterns are not the same. That's why I think you can't have a script for that. You have to learn, and sometimes just through experience. Assess the communication style. Again, talked about this many times. Look at the communication style. Very important. Screen for trauma history. What is the trauma in relationships? Is there been sexual violence? Has there been domestic violence? Has there been sexual health issues? These are all important about how relationships and love and dating and then going to engagement, marriage is concerned. Treatment planning. Integrate multiple modalities. Do not just use one type of style. You've got to think of many different ways. And this is also through your training and also through experience as well. You get better at it, but you do need to look at different approaches, which is why I don't think if you just went to one hypnotherapy and they don't know anything else, it wouldn't work. If you just went to a counsellor, relationship counsellors don't have the way of getting into the subconscious of changing that and reframing it. Because people can talk all they want in a counselling couple situation. When they come out, it doesn't work. Especially if that person's got sociopath or psychopathic tendencies or is a narcissist, incredibly difficult for them to change. So we have to look at that as well. Focus on attachment patterns. Again, same what I said before. Address individual and couple dynamics. So what's the individual like? That's why I feel with couples counselling doesn't work. I think you need to work with the person individually, and then you need to work with them in the couples and bring them in every so often. So you can see how they work individually, understand them individually, then work as the couple. I think it's very important. I think the couples counselling make that mistake because they're always in the couple. And people can actually use that couple's dynamic and they can act a certain way nicely to a therapist, but that's not who they are in real life. Got to be very wary of that. People can be very manipulative. So you have to look at that a lot. Individual regular progress review. Review how people behave, how they're doing, how you can see them changing. Yeah. Professional considerations is maintain your appropriate boundaries. I think this is probably one of the most important ones because people will try and pick sides, especially with your therapist. You try and you get to pick sides. You don't. You keep level-headed. You're not judgmental. You assess what has happened and you look at where both of them can redeem the issue. Do not go to one side, because there's always multiple faceted ideas of how this works. Regular supervision, I think, is very important as well, is always within boundary setting as well, is keep a checkup of how clients are doing. How do they feel? How do they feel in that situation? And the next one is cultural competency development. So how to culturally be the competency development within a relationship is very important. So all these guides of the 2 parts which I've shared today, they cover the essential aspects of treating relationship issues in pre-engagement couples. So a couple of points to emphasize just to finish off is the importance of addressing attachment patterns early in therapy, as they often underline many relationship difficulties. Number 2, the value of integrating multiple therapeutic approaches. Hypnotherapy can be particularly effective at addressing deep-seated patterns, while CBT provides practical tools for immediate behaviour change. Number 3, the necessity of regular assessment and progress monitoring using standardised tools alongside clinical observation. And I would go number 4 is honest and open communication. Without these parts, as a therapist to a client or without the clients working, none of these things will ever work. So one of the things you can take away is probably your big takeaway is communication is key in any relationships working or through development. Until next time, speak to you soon.